When I went to Iraq in 2003, our government had not yet caught up to understanding what PTSD was, let alone doing anything proactive to treat it.
But we've had a lot of trouble with Western mental health workers, especially the ones who came right after the genocide. And I said, what kind of trouble did you have? And he said, they would do this bizarre thing. He said they didn't take people out in the sunshine where you begin to feel better. They didn't include drumming or music to get people's blood going. They didn't involve the whole community. They didn't externalize the depression as an invasive spirit. Instead, what they did was they took people one at a time into dingy little rooms and had them talk for an hour about bad things that had happened to them. He said we had to ask them to leave the country.
What I find really fascinating is that the pharmaceutical industry use exactly the same kinds of tricks and devices, but slightly more sophisticated versions of them, in order to distort the evidence that they give to doctors and patients in which we use to make vitally important decisions. So, firstly, trials against placebo.
The treatments we have for depression are appalling. They're not very effective. They're extremely costly. They come with innumerable side effects. They're a disaster.
I found out after he passed away, he only saw his psychiatrist 3 times, I think it was. That was only to address medication.
He hopscotched between doctors and medications and finally dropped out of therapy. Some family members say their loved ones were over-medicated.
I was struck by the fact that depression is broadly perceived to be a modern Western middle-class thing. And I went to look at how it operated in a variety of other contexts. And one of the things I was most interested in was depression among the indigent. And so I went out to try to look at what was being done for poor people with depression. And what I discovered is that poor people are mostly not being treated for depression. Depression is the result of a genetic vulnerability, which is presumably evenly distributed in the population, and triggering circumstances, which are likely to be more severe for people who are impoverished. And yet, it turns out that if you have a really lovely life but feel miserable all the time, you think, why do I feel like this? I must have depression. And you set out to find treatment for it. But if you have a perfectly awful life and you feel miserable all the time, the way you feel is commensurate with your life. And it doesn't occur to you to think, maybe this is treatable. And so we have an epidemic in this country of depression among impoverished people that's not being picked up and that's not being treated and that's not being addressed. And it's a tragedy of a grand order. And so I found an academic who was doing a research project in slums outside of DC, where she picked up women who had come in for other health problems and diagnosed them with depression, and then provided 6 months of experimental protocol. One of them, Lolly, came in, and this is what she said the day she came in. She said, and she was a woman, by the way, who had 7 children. She said, I used to have a job, but I had to give it up because I couldn't go out of the house. I have nothing to say to my children. In the morning, I can't wait for them to leave, and then I climb in bed and pull the covers over my head. And 3 o'clock when they come home, it just comes so fast. She said, I've been taking a lot of Tylenol, anything I can take so that I can sleep more. My husband has been telling me, I'm stupid, I'm ugly. I wish I could stop the pain. Well, she was brought into this experimental protocol, and when I interviewed her 6 months later, she had taken a job working in childcare for the US Navy. She had left the abusive husband, and she said to me, my kids are so much happier now. She said, there's one room in my new place for the boys and one room for the girls, but at night, they're just all up on my bed and we're doing homework all together and everything. One of them wants to be a preacher, one of them wants to be a firefighter, and one of the girls says she's going to be a lawyer. They don't cry like they used to, and they don't fight like they did. That's all I need now, is my kids. Things keep on changing. The way I dress, the way I feel, the way I act. I can go outside not being afraid anymore. And I don't think those bad feelings are coming back. And if it weren't for Dr. Miranda and that, I would still be at home with the covers pulled over my head, if I were still alive at all. I asked the Lord to send me an angel, and he heard my prayers.
You consistently see people doing trials still against placebo, and you can get licensed to bring your drug to market with only data showing that it's better than nothing, which is useless for a doctor like me trying to make a decision. But that's not the only way that you can rig your data. You can also rig your data by making the thing that you compare your new drug against really rubbish. You can give the competing drug in too low a dose so that people aren't properly treated. You can give the competing drug in too high a dose so that people get side effects, and so you're bound to make your new drug look better. And so it's no surprise that overall, industry-funded trials are 4 times more likely to give a positive result than independently sponsored trials. But, and it's a big but,
the worst depression, perhaps, that I've ever seen in a man. He was constantly depressed. He was, when I met him, at a point at which every month he would have electroshock treatment. Then he would feel sort of disoriented for a week. Then he would feel okay for a week. Then he would have a week of going downhill, and then he would have another electroshock treatment. And he said to me when I met him, "It's unbearable to go through my weeks this way. I can't go on this way, and I figured out how I'm going to end it if I don't get better." But, he said to me, "I heard about a protocol at Mass General for a procedure called a cingulotomy, which is a brain surgery, and I think I'm going to give that a try." And I remember being amazed at that point to think that someone who clearly had so many bad experiences with so many different treatments still had buried in him somewhere enough optimism to reach out for one more. And he had the cingulotomy, and it was incredibly successful. He's now a friend of mine. He has a lovely wife and 2 beautiful children. He wrote me a letter the Christmas after the surgery, and he said, "My father sent me 2 presents this year. First, a motorized CD rack from the Sharper Image that I didn't really need, but I knew he was giving it to me to celebrate the fact that I'm living on my own and have a job I seem to love. And the other present was a photo of my grandmother, who committed suicide. As I unwrapped it, I began to cry, and my mother came over and said, 'Are you crying because of the relatives you never knew?' And I said, 'She had the same disease I have. I'm crying now as I write to you. It's not that I'm so sad, but I get overwhelmed. I think because I could have killed myself, but my parents kept me going, and so did the doctors, and I had the surgery. I'm alive and grateful.'"
It turns out, when you look at the methods used by industry-funded trials, that they're actually better than independently sponsored trials. And yet they always manage to get the result that they want. So how does this work? How can we explain this strange phenomenon? Well, it turns out that what happens is the negative data goes missing in action. It's withheld from doctors and patients. And this is the most important aspect of the whole story. It's at the top of the pyramid of evidence. If we remove half of the data, we can never know what the true effect size of these medicines is. And this is not an isolated story. Around half of all of the trial data on antidepressants has been withheld. So this took all of the trials that had ever been conducted on antidepressants that were approved over a 15-year period by the FDA. They took all of the trials which were submitted to the FDA as part of the approval package. So that's not all of the trials that were ever conducted on these drugs, because we can never know if we have those, but it is the ones that were conducted in order to get the marketing authorization. And then they went to see if these trials had been published in the peer-reviewed academic literature. And this is what they found. It was pretty much a 50-50 split. Half of these trials were positive, half of them were negative, in reality. But when they went to look for these trials in the peer-reviewed academic literature, what they found was a very different picture. Only 3 of the negative trials were published, but all but 1 of the positive trials were published. Now, if we just flick back and forth between those 2, you can see what a staggering difference there was between reality and what doctors, patients, commissioners of health services, and academics were able to see in the peer-reviewed academic literature. We were misled. If I conducted one study and I withheld half of the data points from that one study, you would rightly accuse me, essentially, of research fraud. And yet, for some reason, if somebody conducts 10 studies but only publishes the 5 that give the result that they want, we don't consider that to be research misconduct. And when that responsibility is diffused between a whole network of researchers, academics, industry sponsors, journal editors, for some reason we find it more acceptable. But the effect on patients is damning.
And I went out and I interviewed person after person who was suffering with depression. One of the first people I interviewed described depression as a slower way of being dead. And that was a good thing for me to hear early on, because it reminded me that that slow way of being dead can lead to actual deadness, that this is a serious business. It's the leading disability worldwide, and people die of it every day.
Current treatments, primarily medications and psychotherapy, are effective, but only for some people, some of the time, and often only partially. Most frustrating to me is that we haven't seen any significant progress in the treatment of these conditions in the past 4 decades.
And so I began to feel myself doing less, and thinking less, and feeling less. It was a kind of nullity, and then the anxiety set in. If you told me that I have to be depressed for the next month, I would say, as long as I know it'll be over in November, I can do it. But if you said to me, you have to have acute anxiety for the next month, I would rather slit my wrist than go through it. It was the feeling all the time, like that feeling you have if you're walking and you slip or trip and the ground is rushing up at you, but instead of lasting half a second the way that does, it lasted for 6 months. It's a sensation of being afraid all the time, but not even knowing what it is that you're afraid of. And it was at that point that I began to think that it was just too painful to be alive, and that the only reason not to kill oneself was so as not to hurt other people. And finally, one day, I woke up and I thought perhaps I'd had a stroke, because I lay in bed completely frozen, looking at the telephone, thinking something is wrong and I should call for help. And I couldn't reach out my arm and pick up the phone and dial. And finally, after 4 full hours of my lying and staring at it, the phone rang, and somehow I managed to pick it up. And it was my father. And I said, I'm in serious trouble. We need to do something. The next day, I started with the medications and the therapy. I had 2 advantages as I went into the fight. The first is that I knew that, objectively speaking, I had a nice life, and that if I could only get well, there was something at the other end that was worth living for. And the other was that I had access to good treatment. But I nonetheless emerged and relapsed, and emerged and relapsed, and emerged and relapsed. And then I began thinking about all the ways people make themselves better. I'd started off as a medical conservative. I thought there were a few kinds of therapy that worked. It was clear what they were. There was medication, there were certain psychotherapies, there was possibly electroconvulsive treatment, and that everything else was nonsense. But then I discovered something. If you have brain cancer and you say that standing on your head for 20 minutes every morning makes you feel better, it may make you feel better, but you still have brain cancer and you'll still probably die from it. But if you say that you have depression and standing on your head for 20 minutes every day makes you feel better, then it's worked, because depression is an illness of how you feel. And if you feel better, then you're effectively not depressed anymore. So I became much more tolerant of the vast world of alternative treatments.
I know a little about the world of ayahuasca, having been to Peru numerous times and done ceremonies and connected with people. A lot of veterans are going to do ceremonies down there. You're aware of that. They're not waiting for things to happen here. They're going to Mexico, Peru, Costa Rica, and other places. The FDA approval is projected to come like in the next 5 to 10 years or something. That's a long ways away. I think a lot of people can't wait that long.
And there's 2 timelines I see in this situation. There's the scholastic timeline, and then there's the layman timeline. 2 totally different worlds. And I understand your point of view of saying, well, okay, wait on the march, scholastically speaking, but on the layman side, there's no time to waste. Because there are private individuals that are seeking these things out as we speak, and they don't have time. And they're not waiting.
Gabor Mate was doing ayahuasca in Canada and got busted for that. So now he does it in Mexico, where he can get away with it, and other places where it's actually legal. So I'm all for the research. I actually have followed very closely the psychedelic brain science research because I'm a neuroscientist, so it's fascinating. There are really very valuable tools to study consciousness. And we have a spiritual brain, there's no question of it, and that's where they take us.
This is highly statistically significant.
So how can psychedelic drugs change the world?
At the Republican presidential debate in Las Vegas, candidates were vying for carpet bombing ISIS, even if civilians get caught up in the fight.
Yesterday's moderate is today's terrorist.
You would, quote, carpet bomb ISIS into oblivion, testing whether, quote,
I don't know if sand can glow in the dark, but we're going to find out.
Not a day goes by that my mom is not lifting me up in prayer.
That's true.
For hours at a time.
You have to take out their families. You are signing your death warrant.
Show them what a B-1 bomber looks like. Show them what they're messing with. Put the fear of God in their desert.
Whole societies, America, violent, irrational behavior.
Can somebody attack me, please?
Me. Do you know that this country never tortured people before W?
We should go tougher than waterboarding.
Substance abuse.
Give me all your money and your drugs. Your morphine and your Demerol.
Insomnia.
Just a few sleeping pills.
But you must be very careful not to drink any alcohol.
When people ask me, gosh, this prescription drug problem, when did it happen? How did it take over? Well, guess what? It's kind of always been around. Laudanum for your baby, too. Giving babies opiates.
Quaalude.
Metrobamate, the housewife's help. Downers, uppers, fours and doors, and Tylenol, pyrobenzamine, hydromorphone.
There's no question that our best, strongest pain medicines are the opioids. The rate of addiction is much less than 1%. They don't wear out, they go on working, they do not have serious medical side effects. And so these drugs, which I repeat are our best, strongest pain medications, should be used much more than they are for patients in pain.
Oxycodone, immediate release, concentrated hit. Really, this is synthetic heroin. This is the Trinity, a hydrocodone product with a benzodiazepine, carisoprodol, Flexeril.
Virtually every major pharmaceutical company in this country has either been convicted of fraud, i.e. ripping off federal government, state government, or individuals, or else has reached a settlement.
High blood pressure.
Muslims. We know our current president is one.
Yes! So we've heard a lot about how different things can have an impact on the outside world, but now we're thinking about an impact on the mind, on psychology. So the psychedelic experience is known to be incredibly profound. An interesting study carried out at Johns Hopkins in the US found that people who'd never taken a psychedelic drug before, when given a high dose of psilocybin and just one experience with this compound, they rated the experience, a large proportion, some 2/3, rated this experience to be among the top 5 most meaningful experiences of their lives. The experience met criteria for a mystical or a spiritual type experience. So just to put this in a context, people would compare the experience to things like the birth of their first child, so major life events that have had a huge impact on their lives and their thinking. Another thing that was impacted on was their well-being. So again, over 2/3 reported an improvement in their sense of well-being. And what's really interesting about this is that this effect was enduring. So it actually lasted for at least 40 months after the experience. That's when the follow-up was done. And these people were reporting improvements in life satisfaction and well-being. Now, another interesting thing is that personality was impacted on. And so one of the major domains of personality, the personality trait openness, which relates to things like flexible thinking, creativity, a willingness to entertain novel ideas, this was significantly increased again over a year after that single experience with psilocybin. Now, changes in personality typically don't happen in adulthood, so this finding was really quite remarkable that personality could change from just one single experience.
This finding is unheard of in psychology research. And it's also great news because openness is correlated with all sorts of wonderful things like creativity and empathy and intelligence. In large-scale studies of how people change slowly over time, researchers have found that openness typically declines as we age. We become more rigid, more conservative, less creative, and less likely to try new things as we grow older. But people who show slight increases in openness report being happier and more satisfied with life. They experience more moments of awe and inspiration. We've been taught since we were kids that the only things that are real are the things we can use language to name and our fingers to point to. We've been told to avoid the scary places in the world and the dark places in our minds. And we're so practiced in self-control and self-preservation that we can't even imagine what it might be like to open ourselves up to the magical and mystical realms of our natural world. And we've nearly obliterated the tools and traditions of our ancestors that might give us access. Thankfully, the mushrooms have not given up on us yet.
Now, what about the therapeutic potential? Well, there are a number of studies that have been carried out. These are modern studies now in the last 10 years or so, looking at a range of different things, anxiety related to dying. A particular study found decreases in anxiety scores, but also depression scores, and these were enduring again. It lasted for over 6 months. Study looking at smoking, tobacco dependence, found 80% abstinence in these people who had many, many years, sometimes decades of smoking, and yet 80% were abstinent at 6 months after having 2 treatments with psilocybin. Also, drinking's been looked at, significant decreases in drinking behavior 9 months after 2 experiences with psilocybin. Anxiety significantly decreasing. This is anxiety related to end-stage cancer. And also this idea that psychedelic drugs negatively impact on mental health has been addressed by population studies. And one in particular surveyed 200,000 people in the US and looked at the relationship between drug use and psychological health, and actually found lower rates of suicidality and psychological distress in those who reported past use of psychedelic drugs. Incidentally, this relationship wasn't found with other drugs. So it does seem to be something selective to psychedelics, but that does address this common preconception that psychedelic drugs, people who take these drugs, it's going to have a negative impact on their psychological health. The data, the evidence simply doesn't substantiate that idea. So what about other changes? Well, there are changes in personality. So when you look at severe depression, you see this skew in these 5 different factors, these 5 different domains of personality. You can see that blue skew with neuroticism there. What we see post-treatment is there's a sort of, to some extent, there's a sort of normalization of the shape of personality. We see increases in extroversion, openness, and also conscientiousness. So this idea that people might become disorganized after the experience isn't supported. Conscientiousness is a kind of domain which relates to orderliness. Another thing that we looked at is optimism. So in depression, it's known that people have a pessimism bias, this negative bias. They see the world in a particularly skewed way. There was this idea that perhaps there's a kind of depressive realism, that people who are depressed have a more accurate estimation of events. But that isn't really substantiated. Perhaps mild depression, there is some relationship there. But in severe depression, there is this strong pessimism bias. So we see a normalization of that post-treatment with psilocybin. So psychedelics, they fundamentally change people's perspectives. This is a quote from one of our patients. He said, after his experience in retrospect, my outlook has changed significantly. I'm more aware now that it's pointless to get wrapped up in endless negativity. I feel as if I have a much clearer picture. So this patient had, he said he suffered for decades with depression. So just to finish, my last few slides are going to look at something else. And this, is particularly challenging, perhaps a slightly dangerous idea, but nevertheless, I think it's important and should be addressed. So psychedelics may change something else. Now, we talked a lot about openness, this personality domain. Interestingly, if you look at political perspective, the personality domain that correlates most strongly with political perspective is openness, and it correlates with liberalism. So that's led me to ask the question, could there be a relationship here between psychedelic use and liberalism? Perhaps we could even look at markers of this in terms of changes in brain activity. Why not ask this question? So this isn't a causal study. You've got to do your research stepwise, but we ran a web survey with some 1,500 respondents, actually. And we looked at whether there was a relationship between different drug use and liberalism. You want to get as many people as possible completing the survey, so don't ask them to report about every single drug that you can think of. So we focused on 3 interesting ones: psychedelics, cocaine, and alcohol. We saw a selective relationship between
lifetime use of psychedelics and liberalism. Interestingly, another measure we looked at, nature relatedness. So of course, in terms of environmental concern and it being such a major issue, nature relatedness is kind of a measure of how much people care about the environment. And we saw, again, a positive relationship between psychedelic use and this concern for the environment or nature relatedness. Incidentally, weekly units of alcohol correlated negatively with nature relatedness, yet this is the compound that is so normalized and so widely used in our society. What's driving this? I'm going to summarize this as briefly as I can. There's a particular aspect of the phenomenology, the psychology of the experience that people refer to as ego dissolution, the sense of losing their normal sense of self that feels so concrete and absolute and perennial and always there. But this is something which dissolves away under psychedelics. And we saw a relationship between the typical, the dose that people would use in a psychedelic experience and how strong their ego dissolution was. And this relationship was selective again. It was specific for this class of drugs. We didn't see that with cocaine. In fact, we saw a positive relationship between a different measure, ego inflation, and the dose of cocaine taken, also the subjective intensity of that, and no relationship there with alcohol. Now, just my last couple of slides. So psychedelics can change the world. They fundamentally change people's perspectives. This questionnaire study should motivate a control study, which we're planning. Does the world want this change? So this stops being a scientific question now, and it becomes a political question, which I don't want to address, and I shouldn't address. But nevertheless, when I give talks about how psychedelics work in the brain, I often show this slide, and really it's making the point that what you see during normal development, during normal maturation, is a kind of change in the brain such that it becomes sort of parcellated off into different systems. These systems have the connectivity within the system strengthens. But this whole process seems to be reversed. There's a kind of regression in the psychedelic state. And this fits very well also with the phenomenology, that it's kind of regressive. If you look at the psychology, people's cognition, their style of thinking becomes more playful, more flexible, more creative, more imaginative, less analytical, perhaps less refined. So again, just to summarize, this is truly my last slide now. The psychedelics can fundamentally change people's perspectives, but the question is, would the world want this change? And it would depend whose world. But this is a provocative slide, but I still think it's worth thinking about this psychological construct of splitting, of seeing the world black and white. And you hear of extremism views kind of promoting this desire for a splitting of camps. You're either in this one or you're in that one. But one of the key characteristics of liberalism actually is a willingness to live with uncertainty, really. It's a willingness to be open to change, to be open to uncertainty. I just want to leave that thought with you. And one final quote that this is from George Bernard Shaw, saying that those who cannot change their minds cannot change anything. Thank you.